Hi, my name is Daniella Maldonado, and I'm going to talk about a novel familial cardiac arrhythmia syndrome with widespread ST segment depression. Definition: the novel familial cardiac arrhythmia syndrome with widespread ST segment depression was described by H. Bongard in 2018. It's characterized by widespread concave upward ST segment depression, and this syndrome is associated with atrial fibrillation and sudden cardiac death due to ventricular tachycardia and ventricular fibrillation, although some dominant pattern is identified.
I grew up doing a lot of backpacking and hiking with my dad growing up, and then he and I started climbing mountains together in my early 20s. My dad passed away a couple of years ago, and shortly after, I started having a lot of PVCs, like a strange heart arrhythmia, which was initially diagnosed as a stress-related condition due to all the grief and trauma of the experience I had been through. Ended up feeling really terrible most of the time, very fatigued and lightheaded and dizzy. But it continued to increase and get worse. So then I was referred to Dr. Dan Moody. And at that point, he did not think they were related to stress at all. It was just an electrical misfiring of the cells in my heart. So early April, I had the heart ablation surgery. And then 4 weeks later, I took my trail half marathon. And about 2 weeks later, I climbed Mount St. Helens. About 3 weeks after that, I climbed Mount Baker. And about 3 weeks after that, I climbed Mount Rainier. It was wonderful to be able to run and not have my heart to be doing anything strange and to feel really good. It was probably the best I felt on a run in a long time.
And now with the applications in medicine, we have the DTU supercomputer. The computer room application in medicine and its function is actually to map the genes of the patient, which can be determined if the person is predisposed to develop newly discovered heart disease.
Occasionally, a patient may exhibit signs of an inherited arrhythmia syndrome that may be resulting in syncope or passing out spells, either in that patient or in the patient's family members. Where we get concerned about this is if somebody has a family history of either passing out spells, sudden death, or unexplained deaths, things like single vehicle car accidents, drownings, or falling off a ladder or things like that, that aren't otherwise explained by other events. That may be a red flag in the patient's family history. If that patient additionally has a personal history of syncope or passing out, or either electrocardiographic or echocardiographic findings that might suggest a predisposition towards a specific syndrome, we may have to discuss what that means for that patient and what that means in terms of us having to deliver additional therapies.
And now with the pros and cons. In the pros, we have that it is common for family members with abnormal ECG to experience severe heart rhythm disorders, and some develop a reduced pumping function of the heart, and in some cases the disease has caused sudden death. And in the cons, we have that it has a systematic discovery of this new genetic heart disease, recently discovered by a very unusual pattern on the electrocardiogram of men who survived cardiac arrest. We have the use of bioinformatics for the study of genetic mapping and discovery of new mutations related to this new cardiac function. And now with the issues applied in Ecuador, cardiovascular diseases are the first cause of death in the country, and the cardiac antiarrhythmics cause around 168 deaths only in 2016.
Heart and the heart signal down to the rest of the muscle, telling it how fast it needs to go. So an arrhythmia being one where that is abnormal. So the signs of arrhythmias are lifestyle change, things that don't feel right. If you don't walk as far as you can, if you can't get out of bed, you're so exhausted, you feel like you're getting cold. And along those lines, your blood pressure is off, your heart rate's either too fast or too slow. These are all signs of arrhythmias. And the things that lead to them are many. They can be innate, things that you didn't do anything to cause them. Other things can be things you've done, i.e. medication for blood pressure wrong. Maybe you took 2 of the wrong medicine. Maybe you forgot to take the medication. Maybe you went into an arrhythmia just because you had too much stress, recently was dehydrated, or you had illness. A lot of triggers for this. The symptoms can be many, but usually there's a dramatic change in what you can do or what you call normal.
And in conclusion, H. Bungard has presumably identified a novel familial cardiac syndrome. The diagnosis of this syndrome is based on ECG, family history, and clinical presentation. Given the prevalence of arterial and ventricular arrhythmias and sudden cardiac arrest, this syndrome appears to be very serious. That's why we need to know the causes and the physiopathology of cardiac arrest.
Genetic factors are important in all aspects of medicine. Heart rhythm problems are one of those. In the heart, we worry most about genes that either cause one or 2 problems. They either cause a heart rhythm problem directly, maybe a life-threatening one, and the other are genes that cause a heart disease that someone would not have otherwise encountered, which, as a consequence of the heart disease, could lead to serious rhythm problems. And so one of the important issues that we deal with in genetics in the heart is to identify those patients who have genetic conditions and treat them appropriately so that complications don't occur. The most common genetic conditions that we commonly encounter in patients with heart rhythm problems are something called a long QT syndrome, which is a condition where the electrocardiogram looks strange. But more importantly, the heart is prone to very rapid rhythms that can cause fainting, and recovery from fainting if the rhythms get better. But occasionally, it can cause a fainting spell that doesn't end, a rapid rhythm that keeps going and will not end until rescued by an ambulance. And that condition is cardiac arrest. And at Fraser, in the medical college, we have genetic counselors who work closely with our clinic to assist us not just in diagnosing these conditions, but in performing the important family screening treatment that's important to make sure that loved ones also